Hi guys, it's Dr. Taylor with Taylor Made Integrative Therapy. Today we'll be talking about knee stability.
The knee joint is made up of four bones: the femur, which starts in the hip, the tibia, which ends in the ankle, the fibula, and the patella or the kneecap. You can see here the femur sits on top of the tibia, and its main job is flexion and extension. It's a hinge joint. You can see also the patella sits along the femur and glides along the patellar groove. You could think of the patella moving along the femur as a train moving along the track. As long as that knee remains stable and it only hinges into flexion and extension, the patella will glide smoothly along the femur. But when it gets out of whack, the train goes off the tracks and bad things happen.
Now, if you recall from our previous videos, the body is composed of alternating mobile and stable segments, and when that pattern is disrupted, pain and dysfunction occur. Typically what we see is the mobile joints become stiff, or we lose range of motion, and it destabilizes the joints above and below it. Now that's the reason why I've done the knee as the fourth video in our series. The first one was foot stability. Again, we have to have a stable base, a stable foot to stand upon, otherwise the rest of the joints collapse like a house of cards. The next one was ankle mobility, the third one was hip mobility, and the fourth is now knee stability. All right, so if your ankle and hip are not mobile, the knee is going to suffer. Okay. First thing we'll do is some self-assessments to determine if you have knee issues stemming from the ankle or the hip. I highly encourage you to go over to the ankle and or hip videos to get those resolved, and then come back here to learn how to stabilize that knee and move properly through the hips and the ankle so that the knee doesn't become injured. So the first test we want to do is a squat test. It is a great overall functional movement test. All right, it reveals a lot of things. So with your feet pointing slightly outside, about shoulder width apart, you're just going to drop down into a squat. And then back up. What we're looking for is the knee to collapse in or the foot to spin out. A shift to one side or the other. From the back, you can see like if one hip is higher or not. From the side, we want to look and make sure that the upper body is parallel to the shins and we're not collapsing too far forward and we're not pancaking, okay? All right, the next test after the squat is the single leg squat. This will really reveal some discrepancies between the left and the right. You can hide a lot of things with the squat, but the single leg squat is much more difficult, and you'll probably see a lot of weakness and a lot of difference between the good side and the bad side. All you'll do is stand on one leg, put that leg out in front of you, and we're going to squat down. Then we'll do the other side. What we don't want to see is the knee collapsing in or too much shear of the knee versus sitting back. So remember the single leg squat test. If you had a lot of knee shearing where the knee just jutted forward, you didn't get any hip hinge, it's probably a glute activation issue. So this is a great way to test to see if your glutes are firing properly and have good timing. This is the single leg glute bridge. You're going to start with your shins as vertical as possible. You're going to straighten one of your knees, and you're just going to push your hips up in the air. Now you should be able to hold this for 10 seconds, and you should feel this pretty much 80–90% of your glute. If you feel your hamstring cramping, or your back is hurting, or your quadriceps is firing, then you're having a glute timing issue. All right, and then you'll do the other side. So go up with that side. For many people, if they do have a knee injury or a knee issue, they're going to have a lot harder time activating the glute on that side. They may feel the hamstring working a little hard or the quad working hard. And the next test is for ankle mobility. So this is the ankle dorsiflexion test. What you can do is get a tape measure and measure out 5 inches. I've already done so. And you'll put your foot right on the big toe right on the edge of that. Make sure everything's lined up. The foot, the knee, and the hip and the pelvis should all be lined up together. And you're just going to move your knee as far as you can go and try to touch that wall. Check out the other side and see the distance. If you have a bad knee and you notice that your ankle is a lot more restricted on that side, that can be one of your contributors to your knee pain. For the other hip mobility tests, we need to have good internal and external range of motion. You can do that seated, making sure your knee stays in one position. You can look at your hip internal rotation. Move that foot out. It should be about 40 degrees. We'll do this side. And if you see a really big discrepancy on your bad knee versus your good knee, that could be a cause of your hip issues. Okay. And the next test is the paper test. You're going to lay on your back, put one foot on the other knee, and you're going to just let that leg drop down to the side. You shouldn't be able to put more than 2 fists from the table to your knee. If so, then that's indicative of tight external rotators or hip capsule. Make sure you do the other side. All right, this one's a little tighter for me, but if you notice that it's a lot tighter on your bad knee side, then that could be another cause of your knee issues. So the next test is the tibial internal rotation test. Now, I know I said that the knee primarily bends and extends, but it primarily bends and extends. What we typically see is when the foot and the ankle are tight and not stable, that we tend to rotate them out, which means the tibia externally rotates. We want to make sure that we can actually internally rotate, because when we squat, we want the knee either going over the toes or even slightly outwards. And the tibia needs to internally rotate in order to do that. So if you're sitting here, making sure the foot, the knee, and the hip are all in alignment, you just rotate your foot in as far as you can, and should be about 30 degrees of that, and then do the other side. And this is actually my bad knee side, and I have a lot less motion here, so that's something I'm going to work on. So now that we've got our ankles and our hips mobilized, let's learn how to move through them while keeping our knee stable. This is actually pretty difficult for most people, but it's very helpful in teaching you how to move and turn and cut, especially in those more athletic sports, okay? So what we're gonna do, if you recall from the first video, we are always doing things barefoot, okay? We're gonna create that foot tripod, big toe, pinky toe, heel, all stable on the ground, and grabbing the ground and a nice stable arch. All right, so facing straight ahead, my foot, my knee, and my hip are all in alignment, as well as my pelvis and my upper body. I'm going to put a slight bend, slight hinge into the hip with a slight knee bend. All right, and now I want you to just turn your whole upper body. Okay, think of 2 different segments, from the hip down and then the pelvis up. There are 2 different segments. All you're doing is rotating the upper body over the stable hip, okay? So we're going to rotate this way. Notice how my knee, my foot, and my hip are all still pointing in the same direction, and then I'm going to collapse in. All right, this is kind of a precursor to the hip windmill. It's just much more easier. It's just much easier because we have 2 feet on the ground. All right, now what I don't want to see is, that's what the knee wants to do. The knee wants to collapse in when I rotate in, and wants to collapse out when I rotate out. But you can see I'm losing stability in my foot. I'm not really moving through my ankle, I'm just collapsing through my knee, and that's going to cause some knee pain. All right, now after we learn to move through that foot tripod, we can take that into a more complex windmill where we only have 1 foot on the ground. Now you can grab like a bar or use a wall, slight bend in the knees, same thing, foot tripod, everything's lined up, and all we're doing is hinging back, and then we open up, and we close down. Now, same thing, I am not letting my knee collapse in and out. I'll show you from the back. So we go forward, opening up, closing down. Not this, and not this. Engaging my glute, driving my knee out, engaging my groin to pull my pelvis in. All right, so those are both really great exercises. After that, you can go into more of a unsupported hip windmill. All right, all great exercises to learn hip mobility while keeping your knee stable. All right, so if we're still having our knees collapse in, even though we don't have any mobility issues, we may need to do some banded squats. This is actually going to force your knees in, and it's going to cue you and cue your brain to resist that and drive your knees out. All right, so you'll put the band above your knees. Again, it's trying to force my knees in, so I'm going to have to fight that the whole time. Now, I'm not just driving my knees out, but I'm actually keeping my big toe and my foot tripod engaged, my big toe staying on the ground, and as I go into my squat, I'm going to drive those knees out and come back up. All right, and do this very slowly. This is more kind of neurological training. Go down nice and slow. Feel those glutes activate and back up. All right, people who have problems with this, they'll go down a certain ways and then all of a sudden it will start collapsing in. Then you need to really drive those knees out. All right, but you won't feel that happen unless you go slow. So give that some repetitions. It'll really open up the hips. Your glutes will feel alive when you stand back up. All right, another functional movement where I see a lot of dysfunction and instability in the knee is the split squat and the lunge. Now the split squat is just this. All right, you go down and you go back up, just like a squat. Okay, but you're in a split stance. A lunge is when you step out and then come back. Now, typically what I see in a split squat is people have pain in the back leg. All right, and that's because they have their weight all back here on that back leg. They use the tension in their hip flexors to pull themselves up. Well, that's incorrect. We want to have most of our weight on the front leg. You can see here, barely any weight on this back toe, and we go down and we go up. All right, so correct that. If you're still having issues, you probably have some hip flexor problems on that back leg, and you should have seen that in the hip mobility video and taken care of that by now. Now let's talk about when you have pain in the front foot. So the other dysfunction I will see is in the split squat stance, they'll go down and they'll either collapse their knee in, showing signs of glute weakness, or they will really shear that knee over the foot. Both are indicative of weak glutes. All right, if you're really having trouble keeping that knee back, put your toes up against a wall and practice your lunge here. That will prevent your knee from going too far forward. All right, it's probably going to shut you down fast, but as long as you sit down and feel that glute activate, you'll be good. One other thing we don't want to do is drop that pelvis. So if you're reaching for the ground with your knee by dropping your pelvis, that's showing signs of weakness in that glute. So now I want to cover side lunges. Most people just work out in a sagittal plane, front and back, right? Lunging forward, squatting, bench pressing, front rows. We don't really go side to side. And it's really important to work in this, we call it the frontal plane, when you go side to side. Now, for athletes, this is really important. People like to play soccer or baseball, any field sports where you're going to be running and then cutting and going in an opposite direction. I see a lot of people do this wrong. So when you're doing your side lunge, they step and they keep the shin vertical and they're almost shifting their weight over. This is very unstable in my knee. What we want to do is when I step, foot is stable, I'm maintaining this arch, my shin is angled right back in the direction where I'm going to go. So I'm here, my knee is stable, my glute is turned on, I'm sitting back into my glute and I'm pushing back. So again, it looks like this. That's why it's important to have foot stability and ankle mobility. We're here and we're pushing back. So let me show you again. We step, I'm maintaining my arch, okay, I'm not letting my foot collapse in or out. Maintaining that arch, I'm maintaining ankle mobility and I'm sitting through my hip. And then I'm going to rebound. So another great exercise we can work on is stair or step. Now, a lot of people have knee issues and aren't able to stabilize their knee when they're going downstairs. And it's a source of a lot of pain. If this is you, it's probably because you don't have good ankle range of motion. So you can see as I go downstairs, I really have to be able to bend my ankle in order to move properly. When we don't have good range of motion, then the knee tends to collapse in, the pelvis tends to drop, and all that force is put into the knee. All right? So if you haven't already looked at the ankle video, I will go ahead and clear that up first. If you're still having knee issues, this is a great exercise to strengthen up the hip muscles and stabilize the knee. You're going to stand on a step sideways. You're going to create that stable foot and maintain the foot, knee, and hip all in alignment. And you're going to hinge through the hip and touch back with your heel like that and come back up, okay? And try to touch the ground like you're touching an egg and come back up very lightly. I don't want to see this where you stomp down on the ground. You can notice I'm also stepping backwards. That's going to teach me how to hinge through the hip versus trying to do it frontward. You can see it puts a lot of shearing force into the knee and I don't really engage my hip as much. All right, so practice those 3 sets of 10, or if you have stairs at the office, practice going up and then down sideways. Okay, what I want to discuss now is 2 easy fixes for knee pain. If you are doing this, where you stick your feet under the chair and your knees are in this fully flexed position for hours at a time, stop it. Just stop it, and your knees will feel a hell of a lot better. The other thing is, don't sit like this. All right, this is mostly women, but I do have some of my male patients that do this a lot, the hyper-flexible ones. All it does is torque the knee. It's actually plantar flexing the foot, causing limited ankle range of motion, and then it's stretching the hip and making the hip weak. So just don't do that, and a lot of times the knee pain just goes away.